You have to unmute yourself. I have shared request. Please unmute yourself. Okay, perfect.
Yeah.
Perfect.
So a brief description about me. Myself, Dr. Mayank Baid. I'm a consultant urologist working at AMRI Hospital, Salt Lake at Kolkata. So moving over to the topic, benign prostatic hyperplasia. It is an aging disease, and it is a most commonly diagnosed prostate condition in men between the age of 45 to 74 years. So as we can see in the picture, it affects about 50% of the people who are above the 60, and that comes to 75% of the age 70 years to almost 100% in the people who are above the 90 years. But all people do not develop symptoms. Only 50% develop clinical symptoms, and among them, only 1 out of 10, that is 10%, people require surgery. So understanding the condition, as we can see on the left side, it's a normal prostate with, as you can see above, there's a urinary bladder, and that is connected, there is a small tube which connects the bladder to the outside world, which is known as the urethra. So as you can see, there is an organ surrounding this urethra. This is known as the prostate. As we grow older, the prostate increases in size. So the prostate can grow from outwards or it can grow inwards. When it grows outwards, it usually does not cause any symptom. But when it grows inwards, as you can see in the picture on the right, it causes compression over the urethra, and that results in narrowing of the urethra and the symptoms of benign prostatic hyperplasia. So first of all, to begin my talk, I would like to clear certain questions which many people ask. Suppose the first one, is BPH a cancer? If I have BPH, can I develop cancer? BPH is not a cancer. It is just the normal benign enlargement of the prostate, which happens in every man above the age of 50 years. And it does not lead to cancer. But at the same time, what is important is that prostate cancer can also present with the similar symptoms of BPH. So to diagnose prostate cancer, screening is also very important. So what we advise to our patient, that those who are above 50 years of age should go annual screening in the form of rectal examination and a blood measurement of serum PSA. The advantage of screening is that we can diagnose the condition at an early age and provide curative treatment for the condition. In people who have got a family history of prostate cancer, we advise to start screening at the age of 45 years. Does vasectomy increase the chances of BPH? No, vasectomy does not increase the chances of BPH. Another very common question which we find among people is that the size of the prostate. So, sir, the size of the prostate has increased, or the size of the prostate has decreased. But the common conception is that the larger prostate means more severe BPH, but the condition is not so. It is only the symptoms which we treat, not the size of the prostate. As I have already explained to you earlier, the prostate, it can grow outside and it also grow inside. When the prostate grows inside, then only it causes symptoms. So in many people, we can find a prostate of 100 grams, but without any symptom. And even a prostate of 20 grams can cause symptom. So moving over to the symptoms, what are the common symptoms? The most common symptom what we see in the people is that night awakening for urination. Other common symptoms are difficulty in passing urine, narrow or weak stream of urination, frequent urination, pain during urination, dribbling after urination, in some cases leaking of urine, overflow incontinence, and problem in draining the bladder. So next we move on to the evaluation. The first evaluation is a clinical examination where we examine the patient. We do a per rectal examination to see the size of the prostate, the grade of the prostate, and also we examine for phimosis, which is a very common condition which can be seen in many people, and that may be responsible for the symptoms. After clinical examination, the most common investigation is ultrasonography, where we look for the kidney whether there is some changes in the kidney or not, the bladder capacity, what is the post-void residual urine, and also the size and volume of the prostate. Another common test is uroflowmetry. It is a test to look for the speed of urination. So it helps us to diagnose whether there is some obstruction. If obstruction is there, how severe it is, whether it is mild, moderate, or severe. And sometimes this is also associated with urinary infection. So we ask for urine routine and culture as well. Some blood tests like PSA, urea creatinine, and uric acid also helps us to aid in the diagnosis. So as I have already mentioned earlier, the cancer, prostate cancer may also present with similar symptoms. So clinical examination and serum PSA measurement is very important. And if we do screening at the right time and we diagnose this condition early, then we are able to provide curative treatment for the condition. Now moving on to the treatment. The treatment, as we all know, should be done in a step ladder pattern. That means initially we start with the lifestyle modification, active surveillance, followed by in some patient we require medical therapy. And those who do not respond to medical therapy, surgical therapy is required, or they form any complication, then we require the surgical management. So moving on to the complication. What are the complications which can happen if not timely treated? So the most common complication what we see in many patients is that they develop an acute retention of urine. That means the lower abdomen, there is swelling, they are unable to pass urine. And as a result, in those cases, we need to put a catheter immediately to drain the extra urine. And then we can plan for the management. Another common problem what we see in many patients is urinary infection. Because of stasis of urine, due to some retention of urine, there is always growth of some bacteria, and that can result in urinary infection. And the most dreaded complication is the back pressure changes, which happens on the kidney due to more retention of urine. So to prevent this complication and also to improve the symptoms and the quality of life, the treatment of BPH is very important and should be done at the right time. First of all, I'd like to discuss about the medical management. But before the medical management, I'll suggest you what are the common lifestyle changes which we can implement and that will help to improve the symptoms. So what we advise to our patient is, first of all, the fluid management. We ask them to drink about, let's say, if the kidney functions are all right, the normal advice is, let's say, about 2 to 2.5 liters of water every day. But the most important thing is that they should take more water in the daytime and avoid taking excessive water about 2 hours before they go to sleep. Another important lifestyle modification, what we advise is that they should follow a healthy lifestyle, take more vegetables, green vegetables, avoid meat, fatty food. These are the certain advices which we ask our patients to follow. Now moving over to the medical management. So medical management starts with the use of alpha blockers. The most commonly used drugs are alfuzosin, tamsulosin, and silodosin. All the three drugs have got their added advantages or disadvantages. What we do for alfuzosin, we prefer to give in a younger people because the side effects of alfuzosin is relatively less, and that is the sexual side effect like an ejaculation. And tamsulosin is preferred for the middle-aged, and silodosin, it is more cardioprotective and it is preferred in the older people. All the alpha blockers may cause slight lightheadedness in the morning when they wake up. So what we advise our patient that when we start an alpha blocker on a patient, when they wake up in the morning or in the night, if they wake up to pass urine, they should like sit for some time and then get up from the bed, because it may cause some lightheadedness and they may fall or injure themselves. But this thing is usually maybe in 2-3 days the body adjusts and the symptoms improve. Another drug which is usually used in combination or for the treatment of prostate is 5-alpha reductase inhibitor. The advantage of 5-alpha reductase inhibitor is that it acts by reducing the prostate volume, and thus the patient who are having larger prostate may achieve greater benefit. What we see is that for a long-term use, let's say for about 6 months, we use the medicine, there is some the maximal effect or the maximum reduction in the prostate volume is observed. The commonly used alpha reductase inhibitor are finasteride and dutasteride. So after this, there's a role of combination therapy. So many patients who have got a larger prostate, and also the symptoms of prostate, we give a combination of drug, that is tamsulosin dutasteride or silodosin dutasteride. And the combination therapy has been found to be more effective than the individual therapy alone. Many patients who either develop complication or do not respond to the medical therapy requires surgery. Surgery is a minimally invasive surgery. As you can see in the picture, what we do, we put in a camera through the normal urinary passage to reach the prostate. And then we remove the extra prostate, which is causing obstruction. It can be done either by using TURP or using laser. So like this is a very minimally invasive surgery. What we do is that there's no cut on the body, and we put in a camera and the prostate is resected. After the surgery, after the procedure, we put in a catheter. What I advise I keep the patient for 2 days with 2 days in the hospital for observation, and the patient is usually discharged with catheter, and we remove the catheter maybe at 5 or 7 days according to the findings during the surgery. Thank you.
Thank you so much for your nice presentation, sir. We will wait for more few minutes if any delegates have their questions so that they can ask.
Yes, definitely.
Sir, as of now, we just received only greetings from the audience. I have put in the chat, no question as of now. So
Okay.
we will wait for more few minutes, sir.
Okay. Okay. Let's say I'll also tell you about something which is known as the prostate cancer. Prostate cancer is a condition. The prostate cancer is a condition which is also have the symptoms similar to that of BPH, may present with the symptoms similar to BPH, but the management is very important, and most important is to diagnose the condition early. So for that, what we advise people, those who are above 50 years of age, should undergo annual screening in the form of rectal examination and also PSA, annual measurement of PSA. So the treatment varies from radical surgery, that is radical prostatectomy, hormonal management that can be in the form of castration, or with the injection like GnRH analogs or GnRH agonist and antagonist, and with chemotherapy and radiotherapy depending upon the stage. So what I advise all my all the people who are above maybe 50 or 60 years of age, those who develop any symptom of BPH, as I've already mentioned, like increased frequency of urination or the narrow stream of urination, dribbling of urination, then please do not hesitate. Please come to your doctor. Please visit a urologist and get the treatment at the right time, and also like improve your quality of life, because it's very important to have a good quality of life, and at the same time prevent complication which can be related to the benign prostatic hyperplasia. Right. So in the chat box, I only see greetings, right? So I think if there are any questions further, then we can reply them later.
Oh, okay, sir, no problem. Should we conclude or should we wait more, sir?
I think we can wait for 2 minutes and then conclude.
Okay, sir, no problem.
Right. So we can conclude this live session. Okay. I'd like to thank the organizer and all the audience and participants who have attended this program. Right. Thank you. Thank you, everyone.
Okay, sir. So, on behalf of the organizer, we would also like to thank you for your insightful and very much educated talk, sir. And thank you so much for your time, sir.
Yes. Thank you. Thank you, everyone.
Yeah.
Bye-bye.
So from here, with your permission, we are ending this session now, sir.
Yes. Okay. Good night.
Hello, sir.
Yeah.
Please wait. There is one question, sir.
Okay.
Yeah, I have put in the chat, sir.
Okay. So Mr. Duari has asked when a patient should go for a doctor advice and what kind of symptoms should be ignored. So, like I have already mentioned, we should not ignore any of the symptoms, even if you have slightest symptoms, like if you need to go for urination multiple times, or if you have a narrow stream of urine, or if you are not able to hold urine, and that means you need to rush to a washroom to pass urine, or you have recurrent episode of burning sensation in the urine or increased frequency of urination, you should visit your urologist. Nothing to worry, because most of the conditions can be managed with medicine or some modification in the fluid intake. And even if we require require surgery in few people who develop complications or if otherwise indicated, but most of the conditions, most of the patients can be managed with medicine. So please do not ignore any of the symptom. Visit your urologist in the right time.
Sir, I think there are no any other question. Okay, so we are ending this session now, sir, from here.
Right.
Thank you.
Okay. Welcome. Good night, everyone. Bye.
Good night, sir.